I'm Associate Professor Andrew Metz. I'm a gastroenterologist and endoscopist, and I'm proud to be the director of the Jreissati Family Pancreatic Centre. Sadly, the outcomes for pancreatic cancer haven't changed much over the last 30 years, and it's projected to be the second biggest killer in Australia by 2030. And despite this, only 4% of research funding goes towards pancreatic cancer. And this is something that clearly had to change. That's why we're so delighted to have received the PanKind Early Detection grant. The support for this, we strongly believe, has the potential to find pancreatic cancer at a much earlier stage and therefore improve outcomes for patients with this devastating disease. We've long known about the interaction between diabetes, chronic pancreatitis, exocrine insufficiency and pancreatic cancer, and for one of the first times we've assembled a team that includes endocrinologists, gastroenterologists, pancreatic surgeons, as well as very enthusiastic research assistants. And we know that patients with pancreatic cancer, around 50% of them have a diagnosis of diabetes, and about a quarter of patients have had a diagnosis of diabetes within the previous 3 years. This really gives us an exciting opportunity to try and work out which one of these patients that's been diagnosed with diabetes or has underlying pancreatic disease would be suitable for ongoing testing to see whether a pancreatic cancer can be detected, and therefore, if this is the case, we have the potential to pick up these cancers potentially 6 to 12 months earlier than symptoms developing. Sadly, most patients with pancreatic cancer present late and are unresectable. This is because, for the majority, the symptoms are very vague, often non-specific, and overlap with a lot of more benign and more common conditions like reflux. And patients have often seen their GPs 3 to 6 times before the diagnosis of pancreatic cancer is made. The members of the research team and I would like to express our sincere thanks to PanKind Australia for their generous funding of what we believe is a really important study. We look forward to getting this study up and racing in the next few weeks, and we look forward to many years of ongoing significant collaboration with PanKind Australia together with our Jreissati Family Pancreatic Centre.